chilling, but a lonely civilian is as common. And some think we're beefing when we're actually bonding. Or it's common as a senior citizen looking at some pictures when her child was a kid. It ain't nothing like remembering. Or common that shackles on our minds and souls. But how long you think these shackles gonna hold? As long as I can breathe, I suddenly swear to make a difference.
Okay, welcome. Thank you so very much for tuning into our discussion today. Folks, I want to tell you that I have a very, very wonderful guest that's coming on today for a very critical issue that is very important to a lot of people, specifically people of color as well. The thing is that August 1st is World Lung Cancer Day. Lung cancer is the leading cause of cancer deaths among men and women, more than colon, breast, and prostate cancers combined. A lung cancer diagnosis often comes as a surprise because the disease doesn't cause many symptoms in its early stages. It's possible to have lung cancer even if you've never been a smoker. There's a story that we'll be discussing later on as an example. But folks, oh my gosh, this guy is on the leading edge of treatment and I'll just say treatment because he's taking us into space age stuff. And I'm just so excited to have him. So please sit on the edge of your seats and absorb as much as you can. Folks, my very special guest today is Dr. Ryan Bylsma from Trinity Health Medical Group. He is a cardiothoracic surgeon, and he's out of Muskegon, Michigan. I want to thank Dr. Bylsma so very much for coming on. How you doing, Dr. Bylsma?
I'm doing very well. Thank you for having me.
I really appreciate you coming on. This is just absolutely incredible. And because of some of the things that you're doing. First, let's talk a little bit about lung cancer.
Sure.
Tell us, what is lung cancer, Dr. Bylsma?
Well, lung cancer is like any cancer in the body. It's an abnormal growth of malignant cells. These happen to start within the lung tissue itself. And there's an abnormality of a lung cancer or a lung cell that turns malignant. And when that happens, it no longer listens to the normal responses of the body that would normally take care of that. And it can grow and does grow, sometimes quite rapidly. It multiplies and grows, and eventually it will start to spread into the lymph nodes and throughout the rest of your body. The trouble with lung cancer is, as you mentioned, as it grows, it does not cause many symptoms when it is still very small and treatable. So most symptoms are not really noticed until the cancer is quite large. And by that time, it's often quite late to treat adequately.
We have preventative measures and steps that we take as it relates to like prostate and colon cancer. The digital, what used to be the digital, because they're stopping to do that right now, but the PSA.
Correct.
What type of preventative steps can we take given the difficulty, as you've just described, the lack of symptoms, the location of where it grows? What are some of the symptoms that could help a person out or preventative steps that they could take to screen themselves for it to catch it at an early stage?
Sure. The best thing that we have currently is our lung cancer screening program. And that is performed with a low dose of radiation, a low dose CT scan that looks at the lungs and looks for any abnormal spots or nodules that could potentially be an early stage cancer. It's not for everybody, and primarily it's used in people who are smokers or at least previous smokers with over a 20-pack year smoking history. And a pack year means 1 pack per day for a year. So if you smoke 1 pack per day for 10 years, that's a 10-pack year smoking history. If you smoke 2 packs per day for 10 years, that's a 20-pack year smoking history. So that's how we count that anyway. Generally patients in between the age of 50 and 80 meet the criteria to undergo that lung cancer screening CT scan. even if they've quit recently, they still would be candidates for having that scan performed.
The reason we have you is that you have a talent that is something that's fairly, well, it is still fairly new. It's not really widespread in use right now, but you provide a robotic type surgery. Let me just say this. What are some of the latest advances in lung cancer treatment, Dr. Bylsma?
Well, I focus on the surgical side of things, of course. So there could be different advances in terms of medication and more treatment of later stage disease. But as far as surgery goes, you're right. Some of the latest advances have been transitioning more into the minimally invasive setting. And that includes quite often the use of the Da Vinci robot, which is what I do. There's also a fairly new way of utilizing that robot to perform the biopsies as well. Our pulmonology team performs most of those, but that has really helped us biopsy a lot of very small nodules that otherwise would be very challenging to get a sample of tissue from. And that has increased our ability to diagnose cancer at an earlier stage.
Well, but tell us why this type of treatment on the horizon that's come and is more preferable than the old style. I mean, is there, when I had knee surgery, they did microscopic, little cuts.
Sure.
Now, isn't that what this robotic technology allows?
Exactly. And that is the large benefit of performing the surgery robotically. To do lung cancer surgery, there's kind of two main portions. In general, you take out the lobe of the lung that has the cancer in it. Your right lung has 3 lobes and your left lung has 2, essentially. So you take out the entire lobe to treat the cancer. That has been done for years with an incision in between the ribs on your side of your chest, which works very well and has for years, but is quite painful. It's painful for the patient to heal from that. If anybody's ever broken a rib or anything like that, every breath and every sneeze, that really hurts. And so as technology has advanced and we've moved to this more minimally invasive approach, with the Da Vinci robot, I can place 5 small incisions across the chest and introduce a camera that lets me get really up close to where I'm working. It's in 4K, it's in 3 dimensions. It's pretty remarkable, the level of detail that I can see. I can also introduce instruments to manipulate the tissue and perform the actual surgery under very close visualization. And we're able to do a lobectomy that way and remove it through a fairly small incision. We just make one of our 5 incisions a little bit bigger in order to remove the lobe. And the benefits of that include a faster recovery and less pain, which is a big deal for patients, of course.
Especially busy patients.
Exactly.
Dr. Bylsma, we had mentioned at the very beginning that lung cancer just isn't something that's systemic to smokers. It's also something that non-smokers can develop. You actually have a story of an example from one of your patients who was a non-smoker. Tell us more about that experience.
Sure.
And how did that affect you and her?
Yeah, so I saw Candace last year. By the time she saw me, she had already been diagnosed with a biopsy, but she had a spot found on her lung on accident, which is quite common. You have a scan performed for another reason. Maybe if you get in a car accident or you have a cough or any number of reasons, you have a scan and they pick up on something that they weren't expecting. And that's what happened with her. and she turned out to have a pretty rare type of lymphoma that originates in the lung tissue. You have lymph nodes and lymph tissue within most of the organs of your body, and for whatever reason, she developed a cancer, a lymphoma that formed a mass in her lung. We were able to do her lobectomy with the robot. She was discharged after a couple of days and really did well.
And continues still yet to do very well, actually.
Correct.
And so a wonderful story. Listen, Dr. Bylsma, because you've given us so much great information, and I'm just so excited about this new development on how lung cancer is now being treated as it relates to the surgical side of it using the Da Vinci robot. Because that's kind of new still. Not a lot of areas have access to that. It's getting more widely used, but it's great to have somebody with your experience in our midst. But at this time, I'd like to give you an opportunity that if there's anything that we discussed that you would like to emphasize more, or that you'd like for people to take away in this discussion, please take this opportunity to share it now. Or
one thing I did want to add, the lobectomy is the major part of the surgery, but another major part is the lymph node dissection. Lung cancer, when it spreads, tends to spread to the lymph nodes within the chest first before it spreads throughout the body. And so making sure that those lymph nodes are clear from cancer is a big deal in terms of staging and prognosis for the future. The robot allows me to have a very good picture of those lymph nodes and lets me perform a very complete lymph node dissection. And it's just much more easily done than with the incision on the side. It's easier to reach certain areas within the chest, and being able to see everything up close like that is pretty remarkable. That has impact on their prognosis, and provides a lot of comfort for patients if there's no cancer within those lymph nodes, of course. Otherwise, I would say, it is relatively new in Muskegon, but it's definitely turning into the preferred approach throughout the country for lung cancer because of all the benefits that I listed. So I work as an employee of University of Michigan, working here in Muskegon, and I'm very happy to provide this opportunity for patients here in their hometown rather than traveling far for their surgery.
Well, I got to tell you, University of Michigan, kudos, because they put out great professionals, and it's no wonder now. And to have a city the size of Muskegon to have access to that type of technology when there's parts of that area that still doesn't even have access to internet.
Sure. Yeah.
That is an incredible investment by U of M, as well as Trinity Health, as well as yourself. So that's a tremendous blessing to that community. And I want to thank you so very much, Dr. Bylsma, for coming on, sharing your knowledge with us, and sharing your time. Thank you so much.
My pleasure. Thank you.